Okay, Mr. Chairman, I believe we're ready to start.
Okay, thank you, Jerry, and thanks for getting everything set up there. We welcome everybody to the Eastern Idaho Board of Health meeting. We'll go ahead and call this meeting to order. The meeting is being streamed on YouTube for any members of the public that wishes to join with that venue. We also have a room available at the Eastern Idaho Public Health Facility for public that shows up at the location and would like to view the meeting there. We welcome you. We are glad that you're able to join with us in the meeting and encourage attendance at each one of our meetings to help you understand the direction that we are going and the information that we're receiving. We appreciate all of our staff and the hard work that they put in each and every week to keep our district current on information and to assist all members of our public. We'll begin with a roll call of our board members. We'll start with our physician, Dr. Nelson.
Barbara Nelson, present.
And Teton County.
Bill Lake, present.
Fremont County.
Lee Miller, present.
Madison County.
Brett Mendenhall, present.
Jefferson County. Jefferson County, Commissioner Young.
Shane Young, present.
Thank you. Clark County.
Greg Shenton, present.
Custer County.
Wayne Butts, present.
Lemhi County.
Ken Minor, present.
And I'm Brian Reed, representing Bonneville County. So thank you. Again, we have our full board with us. And I think that's quite extraordinary with the amount of work that you all do and the time commitment that you have given to this board. So thanks again for your attendance today. It is certainly helpful. First on our agenda is approval of our October 22nd Board of Health minutes. They were sent out to everyone for review. They are also on our website. If there are no changes or additions needed to those, I would welcome a motion to approve.
Yeah. Mr. Chairman.
Yes, go ahead.
Commissioner Young, I just noticed on the, it mentioned Dr. Larson's presentation can be viewed here, but I didn't see a link on it on mine where you could view his presentation. Was that supposed to be there or maybe I misunderstood it?
Mr. Chairman, it was not linked to the minutes. It was linked to the meeting materials on our website. If you would like, I certainly can link it to these minutes electronically.
Okay, I wouldn't mind it because I was going to view it, but I didn't see where to go see it.
Okay, we will make that addition then to the minutes.
Okay.
Thank you.
With that, I'll make a motion that we approve the minutes.
Okay.
Second.
Commissioner, and a second from Dr. Nelson. All in favor, say aye.
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 All right, thank you. We will make that addition to the minutes. We will next move on to a great part in our agenda. As everyone knows, October is Breast Cancer Awareness Month, and we have had two individuals in our area who have been working hardly to help assist in that manner. And I will go ahead and turn it over to Savannah Nelson and Cherie Webster. I'm not sure if Cherie's here, but I see Savannah. And Savannah, would you please explain to us what prompted you to go about the work that you've been doing during October and your experience?
Yes, so, sorry, excuse me. In one of my classes at BYU Idaho, we were told to choose a passion project, something that we're passionate about to work on this semester. And the first thing that came to mind was my Aunt Sarah, who was diagnosed with breast cancer and has been receiving treatment and is now clear of breast cancer. but she was able to detect her breast cancer early. And I know how important early detection is for breast cancer screenings. And there's not as much as there used to be to raise money for uninsured women who need to receive mammograms. And so I decided to advertise and create a GoFundMe. And I called my organization Sarah's Fund for Early Breast Cancer Detection. And I've been sharing it all October. A lot of people from the community have shared it. My GoFundMe's been shared over 230 times. And I was able to raise $5,000 for the public health so we can make mammogram vouchers for those that are uninsured and need to get mammograms done.
Oh, what a tremendous thing that you have done there. We appreciate that very much. So my understanding is you will be making that donation then to Eastern Idaho Public Health to assist with those vouchers. Is that right?
I will, yes.
Okay. Well, thank you, Savannah. We really appreciate the efforts that you've done. We wish you well in your class and wish your aunt well and everyone who deals with breast cancer. You are certainly correct that early prevention is the key in that.
Thank you.
Is there anything else you'd like to add?
I just want to thank those that have donated. I've had over 25 people donate and some organizations as well. So I just want to give a big thanks for that. We have a great community that was there to step in and support this.
Thank you, Savannah. Your efforts will certainly save lives. And so thank you.
Thank you.
All right, we'll move on to the next item on our.
Mr. Chairman,
Yes, go ahead, Jerry.
I just wanted to see if Cherie is in fact on the line. I see a phone number I don't recognize, so that, Cherie, if you're on the line, please go ahead and speak up. Maybe not, but may I just make one more comment?
Sure.
I just want to thank Savannah so much for your efforts. Just so people know, here at Eastern Idaho Public Health, we have a program called Women's Health Check, and it does provide breast and cervical cancer screenings for women that are uninsured or underinsured. This year has been challenging, but we do have funding to serve women. And so if there's women out there listening, or you have someone, you know of someone that could be in need of the services, they can just contact our office at 208-533-3209. And then what Savannah, her efforts, as she mentioned, help fund the mammogram voucher program. And so aside from our Women's Health Check program, we are able to help women that don't have any other resources through these donations like Savannah's actually get mammograms that can be life-saving. And so just want to make sure the public are aware of that it's a great resource, and we have funds to help women. And so anyone in need, please just give us a call. And thanks again to Savannah for your awesome efforts.
Thank you, Director Cow. Yeah, we appreciate that. And yes, thanks again, Savannah. We'll go ahead and move on then in our agenda to our reports from our hospitals. And we'll begin with Idaho Falls Community Hospital. Mr. Jackman, thank you for being with us this morning.
Good morning. Thank you for having me. The past couple of weeks have been interesting. I think I mentioned on my last report that we've had several instances where we had utilized all of our ventilators that we have in place. We had 8 when we opened the hospital. We have since acquired, through the state help, through Jerry, 2 ventilators from FEMA. So we have a total of 10. We, in the past 2 weeks, have had one instance where we were using 9 of those 10. Currently, I have 4 COVID patients in the ICU and 6 patients out on the medical floor. We have patients from Bonneville County, Fremont County, Bingham County, and Jefferson County. We are seeing quite a few patients come through the emergency room that we're able to treat and send home. But we are seeing quite a few patients being sent to us from physician offices and a couple of the other outlying hospitals that are in need of a little bit more acute care. Staffing wise, we seem to be doing a little bit better than we were a couple weeks ago. But we have had a couple of times in the ICU where we did not have enough staffing to be able to handle some patients. And luckily I was able to send those over to Eastern Idaho Regional Medical Center, and they were able to keep those patients here in this area. But I'm sure that put an additional strain on them.
Okay. You said you have 4 in your ICU. I don't recall. What is your total capacity in your ICU?
My total capacity in the ICU is 10.
Okay.
I just have 4 COVID patients out of those 10.
Okay, sure. Are there any questions for Casey Jackman? All right, thank you, Mr. Jackman. We'll go ahead and move on to Eastern Idaho Regional Medical Center. Mr. Hoffenberg?
Commissioner Reed, can you hear me?
Yes, I can. Good morning, and thank you for being here.
Good morning. Thank you. To give you an update, currently at ERMAC, we have 33 COVIDs in the facility. 8 are in our ICU and 28 are our med-surg floors. Our total hospital census is kind of where we're seeing a huge bump again. We're up at 243, and for us, that's a pretty big number in terms of our total beds used. So where we have capacity, obviously, is in our women's and NICU area, but everywhere else, our med-surg floors and our ICU, we are very, very full. As always, our human capital is what we are most focused on, ensuring that we have enough staff and enough folks to take care of the patients that we have. So in our ICU in total, we have 28 patients, and right now we again continue to just focus on having the employees ready to care for these patients, and so we are continuing to bring in travelers and continue to get staff off of orientation who've been hired. Over the next month to 2 months, we anticipate a total number of between 6 to 10 new ICU nurses, not including travelers that we're bringing on right now. So we hope going into the winter time, we're in a much better situation. Right now, we are managing well, but still very tight. So just wanting to keep our folks healthy and happy and not burnt out, and that's where we're trying to manage a lot of our team members right now is just managing that human burnout and making sure that they can continue to safely and in a positive way care for all of our patients, because they've been on a very long road. It feels as though our ICU has not had many more than 1 or 2 relief points since July. And so we've just continued to remain very, very full since trauma season. And, what we normally see in our October, November time where we see a bit of a lull, we're just not seeing it this year. Obviously COVID's a part of that, but we continue to see patients from other areas around the region that we're typically not seeing patients from. Community example that we've gotten several patients from is Lander, Wyoming, which for us is it's good. We partner with that community in the past, but it's not typical where we get standard ICU patients, where that tells us that those beds in Casper, in Billings, and in other communities where they typically send patients are filling as well. So their need is that they're having to go to other regional medical centers to get their patients cared for. We continue to see a lot of patients from the Twin Falls area, from Sun Valley, from all over Montana, and right now our COVID patients are from a number of communities from throughout the region. So our goal is to continue to keep our beds available for those trauma patients, those stroke patients, those cardiac patients that need those higher level care beds. And so throughput's always a daily focus for us, trying to make sure that we're getting folks home discharged safely and then having beds available for patients that need it from the local area and throughout the region.
Well, thank you. Thanks for all the effort that you're making, your extra hirings, everything that you're doing for the community. It certainly is obvious that COVID has placed such a great strain on the hospital system. And, some people have had questioned if the case counts are accurate, if everything's accurate, but the evidence is in the pressure on the hospitals, I believe. And you've certainly expressed that to us this morning. Are there any questions for David Hoffenberg?
Yes, Mr. Chairman Reed. I'm curious, are the hospitals that are being, with the influx of the COVIDs, are they still able to run their business as usual as far as doing the elective surgeries and things like that to help the community?
Go ahead, Mr. Hoffenberg.
Yeah, thank you, Commissioner Minor. The short answer is yes. It's obviously tough, especially with patients who are needing admission. That's where we kind of hit the pressure point first. If there's a surgical patient that needs an inpatient bed or, a procedure that needs a bed, we're really having to juggle, look at our schedule ahead of time to try to fit those patients in. Where it's easier, and I think, Casey could also say the same, and same with Rachel up at Madison, is our outpatients, those patients were able to easily get in and out. It's more just keeping their visitors safe, making sure that they're masking when they're in the facility, and having staff available for them. But our crunch point is on our inpatient side of the hospital.
Thank you.
Any other questions? We'll go ahead and move on to Madison Memorial Hospital. Report from Dr. Gonzalez. Good morning.
Morning, everybody. We currently have, this morning, only three COVID positive inpatients. But I know that we've got a number of patients. We've got 3 on our med-surg floor that are requiring one-on-one nursing. And our ICU has been pretty busy with other types of patients. And I know that we transferred during the night another COVID patient down to Idaho Falls because of the specialty care required. And so exactly what the gentlemen were reporting, it's very helpful for all of the surrounding hospitals to have the support of the hospitals in Idaho Falls. And we've been, I know our physicians have been continuing to work together through all the hospitals of which patients do we transfer, and based on resources, and really looking at that, trying to help each hospital with all of their resources. So I think we've been doing a good job in the region with all the hospitals of managing. I think I think you said it well. It's the ongoing process of this and some of the fatigue and, pulling nurses, staff from all sorts of different areas of all of our hospitals, covering things. And, I had a conversation with a patient this week, making a comment of, well, how come you don't just hire more nurses? And I was explaining to her that a nurse isn't a nurse. Basically, you have different physicians with different specialties. You have different nurses with different specialties. And we had that conversation, takes time to train and everything that David was going through. And she said, I had no idea. And it was just interesting. I thought, well, we need to do a really good job at educating our public. All the hospitals are doing the best we can, but we all have our different niches and things that we do well, and different staff that do things. And it takes us time to have those experts able to cross-train and do other areas. So, again, I think all the hospitals are managing, but it's certainly ongoing, and we'll see what the rest of the year brings us. And hopefully 2021 is a great year, right? I don't have anything, but thank you.
We are all looking forward to 2021. So thank you, Dr. Gonzalez. We really appreciate your report this morning and each and every one of our meetings. I have a question for you or any of the hospitals, just so I fully understand. What is the typical reason that someone ends up in the hospital with COVID? Is it respiratory problems? And Dr. Nelson, you could probably answer this as well for me, but is it their oxygen level drops? What is the trigger point to when someone is sent to the hospital?
Yeah, it's when they're unable to maintain their oxygen saturations.
Okay, so that's the number one trigger point that a physician would look at in order to send someone in.
Correct. Altered mental status or super high fevers as well.
Okay. All right, thank you. This disease varies so much from person to person. It's been very, very confusing to the layperson who doesn't understand the medical side of it as well as you do. Any other questions for Dr. Gonzalez? We'll go then to Steele Memorial Medical Center in Salmon, and up in Lemhi County. I know they have struggled with a bit of an outbreak up there, and we've been watching that closely and wish them well and wish to give as much support as possible up there. I believe we have Lisa Lofgren, the Chief Nursing Officer from Steele Memorial. Is that correct? Are you on the line with us?
Yes, I am. Thank you very much, and good morning. Yeah, it's been challenging here the past 2 weeks in our little COVID blossom. You know, our resources, we don't have a lot of depth here, so it doesn't take much to turn us upside down. This past week, we have had as many as 6 COVID isolation patients on our med-surg floor, which we managed to the best of our ability. We currently today have 2 COVID patients. We are a hospital that relies so deeply on outlying resources to transfer our patients to. So we've been having to reach far to some of our outlying hospitals to accept some of our COVID patients. Yesterday morning, we had to transfer a patient out, and we had a hard time finding transportation that would take the patient due to the patient's oxygen needs. So that was a little bit of a scary challenge for us. This past week, we've transferred out 10 patients. We are seeing in our emergency department an average of probably 4 to 5 COVID patients a day. And when you have a core nursing staff of 1 ED nurse and 1 ED doctor, it's extremely challenging. I myself am being pulled to the floor to work shifts right now. All of our nurses are working extra shifts above and beyond their FTE status. And so we are doing our best to support the patients that are coming to our emergency room, doing our best to support the patients that we have. Our numbers look like they might be on a slight downward trend, we hope, from what we were at up in the 70s per 10,000. Everyone is doing the best they can. It's just unprecedented times here, and we continue to educate the public to wear masks, to social distance, to disinfect. That's been our big message, is public education to, if everybody can please do their part to really try to slow the spread to the best of everyone's ability.
Thank you for that report. And yeah, we do feel for the position that you're in right now, particularly with your nurses and doctors and your facility there. We know that you've been overrun, and we just wish you well. And again, give you all the support. I know our director has been in constant contact with you up there and offering any support that can be given from this area. So are there any questions for Ms. Lofgren?
Mr. Chairman?
Go ahead, Commissioner Shenton. Commissioner Shenton, did you have a question?
Yes, sorry. I just had a question. those 10 that you transferred out this week, did most
Uh-huh.
go to Idaho Falls?
No, they have gone all over. We've had to transfer as far as Kalispell. We've been really happy. We've transferred some down to Boise, community up in Missoula. We've been reaching far and wide to place our patients.
Okay, thank you.
Yeah, that's a good question. Are there other questions? Okay, we again wish you well. We thank each one of you involved with the hospitals for, again, all the work you're doing and for taking the time to be with us this morning during this busy time. I appreciate what Ms. Lofgren said about encouraging the public to do all the mitigation strategies that we are asking. We see the good that it can do. You know, anecdotal evidence from Madison County shows that with the extra efforts that they've made up there in the last 2 or 3 weeks, and the efforts from Mayor Merrill and everybody involved up there, it has made a difference. It is helping, and so we encourage that everywhere. So we support your message, Ms. Lofgren.
Thank
Anything else, Jerry, that you would like to add at this point, or you want me to move on?
No, we can go ahead and move on, Mr. Chairman.
Okay. We'll go to the next item, which is our COVID-19 update from Director Ratkow and Mr. Corbett.
Thank you. I just want to update on several things, and then I'll turn some time over to James to look at the data with us. Last Thursday, Dr. Deborah Birx, the ambassador from the President's White House Coronavirus Task Force, visited Idaho Falls, obviously because our state has seen a significant uptick in COVID cases in our region specifically, Idaho Falls, Madison County, Fonville County, being some of the hot spots, not just in the state, but in the nation. We were able to have a conversation with her and the governor and Director Dave Jepson and Elke Shatolik from the Department of Health and Welfare, just talking about our experiences in Idaho. Public messaging was one point of discussion, that it has been very challenging as we get different messages coming from different leaders. And we've talked about that on this board, with this board before. Just trying to figure out how we can better message to specifically that 18 to 29-year-old age group. And so the state is working on how they can better develop a campaign that will speak specifically to that target audience. We are seeing in our health district, obviously, that is the age group that has the highest percentage of cases from all of our cases in our health district. We also talked about testing, and obviously a key strategy to controlling this pandemic is testing. And still in Idaho, and specifically in Eastern Idaho, our health district, we still don't have, while testing resources have increased from the early days, it's still not at a point that we have rapid testing available for everyone that needs it. Not even all symptomatic patients can receive a rapid test at this point, let alone asymptomatic patients that would give us a better idea of the level of illness in our community. I reported last time that the state has been receiving a supply of the Binax Now tests. Those are the rapid antigen tests, and they are being deployed to the health districts across the state. The state's testing task force has developed some priority groups of who will be receiving those testing supplies, and we're continuing to get weekly shipments of that. K through 12 schools was the initial priority, healthcare providers, EMS. Our most recent shipment is targeted to corrections and our county jails. The Idaho Department of Corrections is working with their facilities to get some of that testing supplies to them. Soon we'll see some tests coming to be used for our universities. And then for the next 3 weeks, the testing task force right now is looking at what priority groups they will allocate the testing resources to. So we have certainly been trying to get those resources to where they need to be. But again, it's not to the level that everyone in our communities that needs to get a test has access to a rapid test. We are seeing actually the people presenting for testing has declined over the last week, and I don't know exactly what to attribute that to. We're certainly still seeing disease circulating in our communities. And I think part of it may just be people are not wanting to seek testing for whatever reason. And that is concerning because if people know that they're positive, they're much more likely to isolate and not spread it to other people. And even if people stay home for a few days while they're not feeling well, those with COVID are infectious for more than a few days. And so it's likely that they can be out in the community transmitting the virus to other people unknowingly. I will say that with Dr. Birx, we did have first the discussion just with local public health and the state staff and the governor. And then there was a broader roundtable discussion with other community stakeholders. We had representatives from our universities, from large business, from the State Board of Education, from elected officials at the county and city level. And again, testing, the importance of testing was discussed in there as well. And also just a request that came out of that group that, that the public listens to city and county elected officials. They listen somewhat to public health. But it would be really helpful if our hospital partners that are on the front lines and dealing with this day in and day out, like we hear at our board meetings, if there could be some more public messaging on a broader scale to the community to help them understand what's happening at the hospital level. We know that not everyone tunes into our Board of Health meetings to hear the important information that our hospitals share. And so that was just one request, that our hospitals ramp up their public messaging and the situation that you find yourselves each week of this pandemic and the challenges that are being faced. And like Dr. Gonzalez said earlier, people generally on the bigger picture just don't understand the situation. It's when we have those one-on-one conversations that they fully grasp the big picture. And the more that we can have that messaging and continue one-on-one discussions, it helps people better understand. And I know the communication piece is a huge part of our response. It certainly has had huge challenges as we've gone along, and we'll continue to do our messaging, but it's going to take increased effort on everyone's part to really have the public understand the severity of the challenge that we're facing right now. Are there any questions about the Dr. Birx visit? Then moving on, last Monday, Governor Little did order a statewide public health, he issued a statewide public health order that put a limitation on gatherings. Our Board of Health already has orders in place in 7 of our 8 counties as we stand today that do put limitation on gatherings, and it's based on a square footage per person based on the size of the venue where the gathering's being held. In the governor's order, the limitation on gatherings is 50 people for indoor venues and 25% of capacity for outdoor venues. He did write in the order that people may request an exemption, and if they want to do that, that they're supposed to submit a plan to the public health district for approval of those exemptions. As you can imagine, Monday afternoon, my phone and email started being hit with people requesting exemptions for events that they have planned. Every person that I've spoken to, I try to explain the reason for the limitation is because we are seeing widespread transmission of coronavirus and the challenge that it's putting on our hospitals locally. As part of the governor's press conference, there were some physicians on there, and we're hearing across the state. While we hear from our hospital, there are stressors, and it's being challenging for them to address, you know, the number of patients they're seeing day in and day out, and they're managing. In other parts of our state, that's simply not the case. And in fact, the hospitals in Twin Falls have changed their routing of patients. They're not accepting pediatric patients and sending them to Boise. Some hospitals have curtailed their scheduled non-emergent surgeries. We see out of Utah that those hospitals are above capacity and may be limiting any admission of patients coming from other areas. So we're seeing our hospitals all around us that are struggling, and listening to Ms. Lofgren saying that they've had a hard time finding hospitals that will accept patients because everyone's going through the same thing right now. So back to the exemptions. As you can imagine, it's created some challenges for how we're going to address those exemption requests that are coming to us at local public health to approve. The governor's order, again, is more restrictive on the limitations on the gatherings, and we do have to follow the more restrictive order that's in place. And so that does put some conflict for us because of the orders that we have in place in our counties. I'm receiving requests from obviously school districts, and they're looking to try to figure out plans of how they can allow their indoor sports in their gyms. From the civic auditorium and the Colonial Theater that have community plays scheduled, to weddings, to other activities. And I guess I am just needing some direction from this board of how you want me to proceed as far as those exemption approvals.
Well, maybe if I can start the conversation, and then I would like input from all of our board. We need your thoughts on this, but as far as the school districts, I believe it's important that we stay consistent and take the same approach that we've taken all along, in that, you know, each school district has an elected board of trustees for their school board that have been elected by the people. They are tasked with protecting and administering the affairs of the school. They have worked hard at that, and I believe that we make them part of the decision, that we keep them. I mean, they're the ones who are tasked for their schools. Our role is to provide the information, the education, just as you have been doing. And if they submit and for an exemption, and they provide a plan that fits within our health order, the 28 square feet, it provides all the requirements that we have in place, the face coverings, then I believe as long as they fit those things, that you would approve it. Again, it's their role as schools and school boards to work with the governor's office to satisfy that. I know they are coming from all over. I was impressed last night, BSU issued a plan to allow spectators and people at the stadium for their home games beginning this Friday. But it was such a well thought out plan. They're doing testing of everybody that comes in. They're providing for the sanitation. They're requiring the face coverings. And I believe that will be the role of the schools in our area as well, for them to ensure that their plan is safe, because their actions and what they will allow at their events is going to make a difference on keeping their children in school and their teachers safe and all of that going. So I would recommend that you allow the schools to provide their plan, to approve it if it fits our requirements, and then to let them work with the governor. As far as the community events and stuff, that's a little different because they don't have a board overseeing them. Thoughts from board members?
Mr. Chairman, this is Bill Lake. I guess the question I have for Jerry would be, does she have the staff to handle reviewing all these requests and to be able to adequately review them and process them?
Mr. Chairman, obviously it puts one more assignment on our already very busy staff, but certainly we will make that happen. I will say part of my concern, and this has been a concern all along, when you go back to the reopening plans of the restaurants, when they were required to submit plans to us, we only got about 35% of the restaurants in our health district that actually submitted plans. Others just went about their business with no input from public health. I can also say that while someone can write what appears to be a very effective plan, the execution of that plan is oftentimes the most challenging part, and it's not as easy to have people comply with the plan that's been written. So it concerns me that, again, we have no ability, we have not in the past gone out and checked on people once they submit a plan. I know that as I was listening to Central District's board, their discussion on that BSU approval as well, that they are actually sending staff to go check on some of these venues that have submitted variances to the order that they have in place in Ada County. So we can here at Eastern Public Health certainly review plans, give approval. That it doesn't mean necessarily that the plan will be followed once it has been approved, and that is a concern to me. That's a concern to me.
Yeah, and your staff is so thin already with the workload that's on, that it would be difficult to go out and review them, and there's really no enforcement mechanism for Eastern Idaho Public Health as far as these go, these school plans and that's why it's important for the schools to submit their plan and then for them to make sure that it's followed. I mean, it's for their best interest. Many of the comments that we received this week, and most of them have been replied to, but are please keep kids in school. You know, that's the message. I personally believe that children should be in school, but it needs to be safely, and that's what the schools are trying to do. And we want to ensure the public that the one message we got last night was keep our kids in school no matter what it takes, or I can't remember the exact wording, but it was that message, and that's what we're doing. No matter what it takes, we're trying to do as much as we can to keep children in school and following these mitigation recommendations will accomplish that. Other comments from the board to help Jerry with the decision? Yes, Commissioner Mendenhall.
Mr. Chairman, thank you. I would support, we have the order, the health order from the governor, and we know that was gatherings of not more than 50. And when those to have a basis, we needed to have a foundation for the metrics because we've been questioned several times. How did you use that? And so I still believe our plan that the staff there at Public Health put together is actually more based on the actual lives of people using the 28 square feet. All of my rambling, what I'm trying to say is I believe that when the exceptions are requested, we would be foolish to not follow the plan that we have in place for our health district. A question immediately came to mind when Boise State submitted their plan. Did that health district approve that plan, or are they just going about it because they want to? I don't know the answer to that, and I don't need the answer, but I would hope the health district approved that plan because it's an exception to the governor's health order. And I believe that our staff should stay with our plan, no matter what our revisions are as we consider them, that Jerry should refer to our plan for exceptions, and that's what we base it on. Whether they follow it or not, that's an irritant. They should. If they're going to submit the plan, they should follow it. And I don't know what else we do there. But I would certainly encourage Jerry to follow our plan in basing her decisions for the exceptions.
Okay, thank you. Other comments from the board?
Yeah,
Mr. Chairman.
Commissioner
go ahead,
Young?
Ken.
Go ahead, Commissioner Miller.
Commissioner Miller, we'll go to you.
It's kind of interesting as we look back since this really started and things happened with the schools. And remember how we really had real concerns about the outdoor rodeos and that to begin with. And the schools really did, I thought they did a good job trying to do the social distancing and the masking and everything they have. And gosh, we've went months and months and people are tired, but we can't give up. We've got to have something in place. And I agree that we need these kids in school and hopefully they can do the activities they can. My hope is that the districts will follow the plan that they put out. That's the concern I have.
Thank you, Commissioner Miller. Commissioner Young?
No, I was just going to reiterate what Commissioner Mendenhall said. If Jerry can do this, we already had a plan, and I believe we should stick to that. And to me, the exceptions with 28 square feet per individual would be fine to me for the exceptions. If we can do that, I don't know. The governor gives us that latitude to make a decision on that. So to me, we just follow our plan. It's still frustrating though that the governor gives us a directive to do and with no mechanism to enforce anything or resources for that matter.
Yeah, thank you. And yeah, there again, if the governor had intended to keep it at a solid 50, then he would not have put the exemption provision in place, but he allowed for that. I heard the governor on the radio last week say that he believes parents should be there watching their children in sports. He supported that. But there again, I hope that the plans that the schools put out are safe, that they're wise in their decisions, because the important thing is keeping these children in schools. I support them doing their activities, but like everything else this year, it's going to look a little different to be able to make sure that we keep these hospital numbers low. We just heard a report that showed we're pretty full. They're keeping up, but they're doing their job, and we appreciate them very much. But we need to support them in that. And so I'm confident that the schools will do that. It's in their best interest. Are there other comments from board members or questions?
Yes, Commissioner Reed. Jerry, did the Idaho Athletic Association talked with you about their plan of how they're running their state volleyball tournament in Idaho Falls last week? Did they ever submit a plan to you? So basically, they put their own plan in order, never contacted the local health district to see if it was good. It seems like it went off without a hitch. And what I'm getting at is, and we obviously should have some oversight as far as different mitigations, what are going on. But at the same time, ultimately, if these schools are going to take the responsibility to come up with a plan and follow our plan, plus whatever they do, submitting a plan to do all that, the time and the effort, especially on Jerry and her staff, as long as they're staying within the guidelines of our plan, I think they have to take responsibility for what it is.
Okay, thank you. Jerry, does that help you understand the direction that we would like you to do? I know you want to accomplish everything. You want to keep our community safe, and we respect you for the incredible effort that you've put forward, but we also recognize the fact that we have some limitations, and we have to involve the entire community to help us in accomplishing this overwhelming goal. And so does that help?
It does, Mr. Chairman. Thank you for the input and the direction.
Okay. Anything else? Go ahead.
Yeah, if it's all right, I'll turn some time to James and we can look at some data. And then I'd like to just finish on looking at our, where we are with each of our counties.
Yes.
So as Jerry is pulling up some of that documentation, I'll just say that Commissioner Reed, we did, or Chairman Reed, we did see, you did mention earlier that we had seen some slight decreases in case counts earlier this week. The last few days have erased those gains. We certainly get questions about the variability of the cases that we report. I just want to mention that we report them mostly on the day they come in. And I say mostly because we do have to have a cutoff point where we have to validate the data and be able to post that. So any reports that come in normally after 3:30 or 4 are not on the website. We have to try to work to get them, the reports in and cleaned up and on the website to, but any cases that are reported to public health, we do report that time. So you'll see that as we go into the cases here in a few minutes that you'll see some variability across the district. And I just want to point that out. The other concern that I just want to mention is that we've had a few individuals reach out to Eastern Iowa Public Health and say, hey, you've never contacted me after my positive case. And after investigation with them on that, we had never received a positive case. With increased testing capability across our district, with that comes some challenges. Providers having to report in a proper way. Not all providers are aware of that. This is new territory for a lot of them, as they normally don't have to do very many reportable diseases. But COVID being a reportable disease, we're certainly trying to educate providers on the proper way of reporting that and to report them. There's also some variability on when those, as we talked all along, on how long it takes for a case to come back from some of the national reference labs, or the lab report to come back from the national reference labs, as well as just overall timeline of those. So as we see the district cases here, you can see that there seemed to be kind of maybe a slight peak kind of in the middle of October, and we were trending downward. And then the last few days we've had a bump up back in the cases. Whether that is an anomaly that the cases have bumped back up and we will continue downward, or whether the slight downward trend was the anomaly, we can't yet determine. That will take a little more time. Certainly, we've seen less testing being done in the last few weeks. And we can, that data we normally get on Thursdays, and we'll put that up later, that percent positivity and overall numbers of tests being done. That is only some of the data. And as I just mentioned with individuals that might have, or doctor's offices or other clinics that have gotten their own testing, they don't always report to the Idaho Bureau of Labs, both their negatives and positives. So we don't really understand the true denominator that is being tested out there, or how many sick individuals there truly are. That's still difficult. What we know is the number of positives that are reported to us. That is the firm number that we can see, as well as the hospitalizations that come out of that. As such, I want to speak just a little bit to the hospitalizations, and we can look at a few hot spots that we've experienced in our district just the last few weeks. Certainly, our overall hospitalization rate is 3.8% throughout this That's of known cases. 3.8% have been hospitalized. In October and just the first few days of November, that has decreased to 3.1%. That's primarily being driven by Madison County. Madison County, with their age demographic of 18 to 29-year-olds, their percent positivity, their percent hospitalization is really only right at 1%, just at 1.01%. So I specifically mentioned that while we do see maybe a slight decrease in cases in Madison County, it will be important to also look at the hospitalization rate that also accompanies that. As they had a very high rate, one of the reasons while we were concerned about that, we were concerned about getting into other populations that would have increased hospitalizations. And we're still concerned about that. I just want to point out, while the rate may go down, it's still appropriate to take precautions with individuals, because if the hospitalization rate goes up, that also could lead to increased hospitalizations. If your hospitalization stabilizes at 4%, where they had been 1%, that's really, looking at their hospitalizations would equal, when you divide their cases by 4. So really a rate of around 20 would equate to the same number of hospitalizations. But they've been seen at a rate of 80 per 100,000, where they hit a few times during this last month. So you do see Madison County being shown. We have seen a decrease in cases. Again, a mid-October peak, most likely. Again, we'll see if that lull was the anomaly, or if we're seeing a trend for the last few days increase. We're hopeful that it is, as you mentioned, with the efforts of the community and Rexburg, and an increased awareness and compliance with good public health principles, that we'll see a decrease or a continual decrease in those numbers. Another hotspot that we talked about certainly is Lemhi. You can see that starting in early October and then really peaking towards this, in the last week of October, they saw a sharp increase in cases in their county, which led to, as their hospital representative Lisa Lofgren pointed out, that they were at capacity at times in the last week, both with staffing constraints as well as a high number of individuals seeking care, enough that they had to send individuals out. That's certainly a concern. I'll just say that their hospitalization rate throughout, and then even in the last month, has been steady, close to about 6% of their hospitalization rate for cases. Another one that I want to point out is we want to just reference Teton County. They had a sharp increase, their #1 day total yesterday. I have not had a chance to look into the details of that. You can see that's quite an increase, or quite a high, really almost a double from any previous day high. We'll look into that and see what that entailed. Moving on, Bonneville County continues to increase steadily over time. We reported in October, our October 8th meeting, I believe, that we were encouraged by the consistency, even with Labor Day, as well as in schools, that we were able to see kind of a stabilization of that number, or the rate in the high teens. Since that time, it has steadily increased to where we're really hovering in the low 30s to high 20s. With our Bonneville County's hospitalization rate of overall, right around 4.9%, 5%. In October, it was 4.4. We're certainly concerned of the steady growth. We'd like to see that decrease. Again, we had a few days of decreasing the last of October and the first part. Whether that was an anomaly in testing, we'll find out here in the next few days to week. If those last few days were just an anomaly in the testing, or if there was a decrease. So overall, the district, we have seen a decrease that's primarily being driven, as it was the increase by the 18 to 29-year-olds in Madison County. But I would caution that the hospitalization rate is what we need to pay attention to, along with the cases. We know that that's what is driving the hospitals to be in the position that they're in, and really some of the reason why we're here. We certainly want to provide information about the likelihood of each county being able to, and what the current state is in each county. Overall, I would say that we're hitting a point in many of our counties and locations that we're seeing continual community spread, which is driving kind of just the overall slight increase for our district. With that, I would kind of open to questions.
I just want to make one comment, if it's all right, before we open it up for comment, is that certainly going into the holiday season, with obviously Halloween just happening last week, as we've seen around previous holidays, we did see cases increase overall. And so we have that concern that we'll start seeing that increase from the Halloween, and then going into Thanksgiving and Christmas time, where there does tend to be much more congregating, even though it's in small family groups. It is inside, which is much higher risk than outdoor gatherings. And I did not mention earlier in the conversation with Dr. Burks last week is she showed some charts of the entire nation, and spreading from the East Coast, slowly moving westward as the temperatures have turned cold and forcing people indoors. States are definitely seeing surges in their case counts, and she associated it to the colder weather and people going to indoors. So we have that to look forward to as well.
If I may, Mr. Chair, one last thing here. I want to point out, just in reference to what Jerry mentioned there in the holidays, you can see, and it's an emerging theory of mine, I will say, that we see cases, really an increase in cases, kind of 3 to 4 weeks after an event at times. So you can see on our district cases that we kind of saw a mild first peak here in early August, about 4 weeks after the 4th of July. The same thing with Labor Day being the first part of September. It was a little later Labor Day. We saw about 4 weeks later, again with conjunction in the start of schools, but Labor Day can't be ruled out, that we saw an increase in cases. It's a concern, at least of mine, and as we talk, that the holidays are certainly aligned, as we see Halloween, and then about 3 to 4 weeks later, the Thanksgiving, and then 3 to 4 weeks later, Christmas. That could have a compounding effect in the rise of cases. So while we may see a slight dip, we're hopeful. We want people to be continuing to be vigilant throughout the holiday season in doing those things that are going to protect them and their close family and friends.
We'd open up to any questions there may be.
I just have a comment.
Go ahead, Dr. Nelson.
Well, it is influenza season as well. We're starting to see a little bit of uptick in influenza cases, so we still need to encourage people to get their flu shots.
Okay, thanks.
Absolutely.
Yeah, Yeah, I know that they're advocating that around the country. And so, yeah, I appreciate that. And we certainly need to keep those numbers down as well, right, to continue to protect those hospitals. Other questions or comments? Okay, hearing none, we'll go ahead and move on then to the last item on our agenda. We are glad that Custer County's rate has gone down. I know they had some yesterday, but they have fallen, and we've been glad to see that. So Jerry, did you have some action that we can take here?
Actually, Mr. Chairman, we accidentally skipped over item 6, which was the review and approval of the revised plan.
Yeah, I just saw that. I'm sorry. That's one of the important things we need to take care of today. I know that you and James have worked incredibly hard on this, and I'm really impressed with what you've put together here. So please show it to us.
All right. So this is posted on the Health District website for the public to see. There's not significant changes in the overall content of the plan. But after we met at our last meeting and talked about some of the changes that we wanted to make, we recognized that probably to be consistent throughout, we needed to make some additional changes. And just on this first page, I just want to highlight that we did incorporate here the change that the board made at the last meeting to change it to lowering to a lower risk level would be after 14 consecutive days below the metric. And then as well as this statement here that a county's commissioners have the option of requesting an order that's in place remain in place for consideration by the board. I did want to just ask one clarification for you from the board is, did you intend for it to be a request of the commissioners or from the Board of Health member from that county?
Thoughts from board members?
Mr. Chairman?
Yes, go ahead.
I would recommend that the member of the health board carry that message from the commissioners. I don't want to be, me personally, I don't want to be acting on my own for a board of commissioners. I would rather have the board of commissioners contact me or tell me, take this to the board, we want to see this keeping going. I don't want to be a unilateral representative of a county commission. That's just my opinion.
Okay, other thoughts, Mr. Lake?
Yeah, at our meeting last time, we talked about that, and the decision was that it would have to come from the Board of Commissioners. And I agree with Brent that any of us, we should be able to carry that message, but it needs to come from the actual Board of Commissioners.
Okay.
This is Commissioner Young.
Go ahead.
I think we need to clarify this in, we can receive requests, that's fine from the Board of Commissioners, but it still is the Public Health Board's decision because we cannot delegate our powers to another board. So I'm thinking that we probably need to clarify that so that it is our power and not the Board of Commissioners' power of decision.
Okay. Other comments?
Yeah, Mr. Chairman, just in the language that Jerry and James have written, Commissioner Young, it says county commissioners have the option of requesting. And so I'm looking at that as that the county commissioners aren't changing the where we are at in the plan. They're requesting. So to me, that's
good.
Yeah.
I think that's good. Yeah, it is still the health board's decision from their input. So yeah, the requesting is a good wording. I can say, but maybe should say, but it's still the health board's decision, something like that to clarify. to realize that it is still our responsibility.
Does that help you with that, Jerry?
Yeah, let me just show you this wording and make sure everyone's comfortable with it.
Mr.
A
Chairman,
county's Board of Health member may request on behalf of the respective commissioners that a public health order issued by the board remain in effect until a time certain. So they can make that request to the board, but it is still up to the Board of Health.
Yeah, I think that's good wording. And we're using commissioners there because mayors, of course, have the ability on their own to issue health orders within their cities. And so that's why they're not included in this. It's just for the counties. So yeah, no, I think that's good. Any questions or comments on that change of wording? Okay, go ahead and move on then, Jerry.
Okay, the next piece that we just wanted to try to do our best to clarify that the basis of our plan is on hospitalizations, and that's how we come up with the active rates. We did update definitions of probable cases because as antigen testing has become available, when a positive antigen test is, when we have a result from a positive antigen test, that is considered a probable case. And so we just explain that here. And then again, we put the various active rates to constitute movement to a different risk level. So what is different in this plan is we increased the rate for moderate risk from 10 to 15 for the majority of the counties. It was 15 already for Lemhi and Custer. 30 was the rate that we had designated at our last board meeting. And for the critical risk category, we did not have a rate. It was solely based on hospital occupancy and crisis standards of care being implemented. I've incorporated that down here, but we thought it would be prudent to actually put an active rate. Again, because part of this is for situational awareness of what is happening within the community. And a rate of 45 per 10,000 certainly is significant disease incident happening in the community. So I just want to point that out. We will not have varying rates for the different counties. It will be 15, 30, and 45 across the board.
Okay.
On the next page.
Go ahead and finish going through it, and then we can come back to some questions.
Okay. On the next page, again, we just reiterated the everyday preventive measures that we want people to follow while we're navigating this pandemic. And then down here is where we explain the mitigation measures that public health will be taking. It does not differ from risk level. So when we start and when we enter the moderate risk level, that's when our Board of Health has determined that they will consider public health orders. And I've outlined that here, what exactly would be included in those orders as they have been historically. Now that can certainly change in the future based on the scenario, but this is what I would anticipate as counties move into the moderate risk level. And then down here, again, just some other recommendations that we are proposing. First of all, that schools implement their school board approved plans, and that hospitals should implement their contingency plans for handling increased volume of hospitalizations. High risk populations should take extra precautions. And then I did include in here, because of the situation that we find ourselves now, in the event that there's public health orders in place, multiple ones, and the example that I gave is right now with the statewide health order in place, as well as our local orders, the most restrictive guidelines should be followed. And then the last thing, Mr. Chair, is on this last page, we just incorporated some public health recommendations for various populations. So high-risk populations, certainly people that have underlying health conditions or advanced age are at high risk for more severe illness. And so extra precautions that they can take. Same thing for congregate living facilities, our nursing homes, skilled nursing facilities, and even our jails. When we get outbreaks in those facilities, it's significant. And so recommendations that we provide to them to mitigate the impact of that as much as possible. I can tell you that we have regular communication with our nursing homes, and they are all doing increased testing at this point. They've received additional resources to be able to help them do increased testing of their staff and residents. And they do have requirements from CMS to do that increased testing based on the positivity rate established by guidelines from CMS. And so we've put links to some of those other guidelines as well. Recommendations for businesses, as well as travel, and then social events and gatherings. And then I did include here the COVID Health Now line, that it would be at people's fingertips, that they can access that resource that we talked about at our last meeting. So I would open it up for any questions.
Questions from the board, comments?
Commissioner Reed, this is Bill Lake.
Go ahead, Bill.
Jerry, on the item where you talked about the most restrictive order would take precedence, shouldn't that be modified unless, so it says something to effect, unless otherwise exemptions are permitted?
Yeah, based on our discussion today, I think that does need to be modified, yes.
Okay, and when I was looking through that, I didn't see exactly where it said you could implement an order for, say, face coverings. Is there a...
So at when we get to the moderate level, the board has chosen to issue orders, and so I just incorporate here, follow the public health order that's in effect for your county, based on our board's decision to do that at the moderate risk level.
Okay, thanks.
Commissioner Young, did you have a question?
Just wondering, is this the first time that we've had a metric community spread rate tied to the critical rate? It seemed like before we just based it upon hospital and capacity and things.
Yes, Mr. Chair, that is correct. And again, the community spread, for a variety of reasons, including our long-term care centers and our schools, many of them base their plan on level of community transmission. And so I did incorporate that for situational awareness.
And at that level, of course, you took out the stay home order. That was removed. I had some concern about.
We did take it out. Right here, this last bullet, that at the board's discretion, depending on the situation, the board could take other action, but it is not just a foregone conclusion that stay home orders will be issued. It will be dependent on the situation and the decision of our board, any action that would be taken.
Okay, thank you.
Mr. Chairman.
Go ahead, Commissioner Miller.
This may be just some editing, and maybe I'm wrong, but under that fifth bullet, follow the public health order, respective counties' orders in its entirety.
Entirety, thank you.
Okay.
I can't tell you how many eyes have looked at this document, so thank you for that.
Sorry about that.
I'm just impressed you found that, Commissioner. That is awesome. Holy cow.
There has been a lot of work put into this, Jerry, and we appreciate all your efforts. I think it's really informative. It's really educational. I was pouring through all of the information you have on that last page, the public health recommendations, and they are so good. The links on the travel, I found those really interesting. You've just had a really comprehensive document here. We appreciate your work. I had one question, while we're approving this, and it goes back to the risk levels. For Madison County, we have their number based on a 40,000 population. I still have some concerns with that. I know that you're trying to base that number on census and on something, firm that you can put your hand on, and you've tried really hard to find some other data that can support a different number. But I just feel that there probably are a higher population there with the students. Have you had any success in finding how to change that number?
Mr. Chairman, thank you for that question. And it's one that we've been grappling with since day one, honestly. And the answer is no, we've not been able to pinpoint any factual number that we could increase the population by to account for the students. We're continuing to have dialogue with the university, as well as we still need to have another conversation with the mayor. If the county commissioners, Commissioner Mendenhall, if any of the county commissioners have some scientific basis that would help us, because we do know that students were included in the census count. Was it 100% of the students? Likely not. But that's where we're struggling is we don't have any evidence to tell us how many were and how many were not. And so we're continuing that conversation, and I will bring back to the board in a future meeting additional information that I gather so we can have continuing dialogue. And I would still just ask if anyone has any scientific basis that could help us with that. We would like to hear it because we've been unsuccessful in finding it up to this point.
Commissioner Mendenhall?
Yes, thank you, Mr. Chairman. You're exactly right, Jerry. And I know you've been wrestling, James has been wrestling with how to arrive at the numbers of students. Some were counted, not all. There is perhaps one bright shining ray. I think the university has percent of increase of students, or there's a number that caught my attention last week, and I've not been able to follow up on that. Chairman Reed has been very generous in wanting to make sure that we're accurate, especially in this strange situation we find ourselves in Madison County with the students. Right now, it may not be as critical with the critical risk. We're already there. We've moved to that critical risk over there. But I'll continue to pursue it with the university and see if we can find some kind of number that shows a scientific increase somehow that's measured. Because when it comes down to lowering Madison County back to a yellow level, just for the sake of mental, emotional output from residents, if we can lower back to the yellow, we want to do that just to help people feel a little more at ease. So it gives us a little bit of breathing time right now. But I'll continue on with that. So thank you, Chairman Reed, for being sensitive to that. And Jerry and James, understand the hard time it is for scientific. That's what's held us back. We just don't have a measure. But I'm still pursuing one thing that I saw from the university. So thank you.
All right, thank you. Are there other questions, comments on the plan?
Mr. Chairman?
Go ahead, Commissioner Shenton.
Yeah, we talked about, we set the guidelines moving in and out of these levels. Did we find out if we had to do that in a motion every time, or did we check with our attorney and see if the health district could just do that without having a meeting?
Good question, Director Echo.
So yes, Mr. Chairman, I did follow up with our legal counsel, and the answer is if the board wants to delegate that authority to me to move a county into a level and issue an order or to rescind an order, you certainly can do that. I would not be inclined to have you do that for two reasons. First of all, I want it to be a dialogue with the board anytime that we do take a formal action to put a public health order in place. And then second of all, because of this change that we made here with allowing input from the county and the board member from that county to have input into whether or not an order is rescinded, I don't think it can be an automatic decision every time.
Yeah, I'd agree with that particular thing. You know, if a commissioner or a county wanted to stay in, we should probably hear that out, and I'm fine either way. I was just wondering if that would help you out too, other than having all these meetings just for that purpose.
Yeah, and Mr. Chairman, may I make one more comment?
Yes.
From going from the moderate level to either high or critical and back and forth, that can be done automatically, again, because we're not taking any additional formal action. It is situational awareness. And so once we adopt this plan today, you'll see that going forward, that I will, once a county has hit the metrics. So for example, today, assuming this plan is adopted, we would move Lemhi County into the high risk, or I'm sorry, the critical risk level today, because they've been above the rate of 45 per 10,000 for multiple days. And then once they're below that rate for 14 days, we would move them back down to the high risk level. But again, that does not take action by the board.
Okay, yeah, thanks.
And based on the report that we received from Lemhi County from the hospital there, I think your situational awareness fits it very well. I think it does describe how it actually is on the ground. So seems like you have your numbers right.
I'm sorry for interrupting. I was just going to say that yes, we've had that experience now of hitting those rates and knowing what that is, the impact is on the hospitals, and we feel comfortable with the rates that we've identified, and would ask for your support and approval of this plan, of the revisions to the plan.
So board members, if there are no further questions, this will require an action to approve this plan.
Mr. Chairman, Commissioner Butts, I would move to do so.
Commissioner Mendenhall, I would second.
Thank you, Commissioners. So we have a motion and a second to approve the plan has been presented with just 2 or 3 slight revisions and some wording. Is there any discussion on the motion? Hearing none. All in favor say aye.
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 Is there anyone opposed? And did anyone abstain? Okay, thank you. And again, thank you for the work in this. We knew from the beginning as we were learning as it went along, I think your efforts were commendable and actually extraordinary in the beginning to put together a plan, because those numbers proved to be fairly close. The work from you and Mr. Corbett were really good. I mean, your assumptions were very close to correct, but now we have further information, and I appreciate the work you've done to develop a plan. And I'm confident now that this is going to be able to stay pretty firm for quite some time. So are you?
As do we.
Okay, thank you. We'll go ahead then and move on to the last item in our agenda, which is the discussion that I started on Custer County. So go ahead with that.
Yes, thank you. And I've just pulled up just for informational purposes, to take a look at what we've been seeing in the county rates for the past couple of weeks. I'm sorry this is not easy to see, but I'll increase it. The one in red that you can see here is Lemhi County. And I guess I would go back to, based on our new metric of 45, going back to October 19th, that they would have been at that high risk level. And that certainly corresponds with the increased cases and the increased hospitalizations for that county. Right here is Custer County, and that's what is on the agenda for consideration today. The public health order there has been in place, and since October 18th, so for 18 days, they have been below the metric of 15 per 10,000 population. This is where it's hard to predict what's going to happen, because for 18 days they've been below the metric, dropping consistently, bumping, but now you can see that for the last 3 days they've increased some. And I don't know what to make of that. I don't know if that will continue, but here we are again with the potential of, you know, a week from now we could be looking at them being over the metric again. And I know we tried to smooth that out by having it 14 days under the metric, but again, with the small numbers in the counties, it is very variable, and it is what it is. I don't know what to say differently, but they have been under the metric for 18 consecutive days. And so in accordance with our plan, I have developed an order for rescinding the public health order for Custer County. Are there any other questions about any of the other county rates before I go off this page? This is Teton County on the far right, Bonneville County on the left. Both have hit that 30 rate that would bump them into the moderate, the high risk level if that continues for 2 more days.
Questions? So let me go then to Commissioner Butts, your thoughts on your county.
Mr. Chairman, Jerry and staff, first off, thank you very much for all the hard work and hours. Again, we never thought we were going to be in this position, but here we are. Yesterday, I was able to visit with the other 2 commissioners. We know that we put these or changed these metrics so that we wouldn't have the yo-yo effect. The other 2 commissioners felt that it was important for the people in our community or our county that if they were to go online and see where we're at, the fact that we have been below the number for over 14 days, their recommendation was to allow us to move to that lower rate, if nothing more than to stop the questions of we're below the metric, why are we still here? And yes, Jerry, with the increase in numbers, hey, we might see it in a few days where we go back, but that was the recommendation from the other 2 commissioners, and certainly I have to carry their concerns.
Okay, thank you, Commissioner. Other comments from the board? If not, I would look for a motion.
Mr. Chairman, may I make one comment?
Go ahead.
I just noticed here at the top a mistake on the document itself. It should say order lifting restrictions for Custer County, November 5, 2020.
Okay. Well,
Mr. Chairman, I'll make a motion. We lift the order for Custer County.
Mr. Butts, second.
okay, I have a motion from Commissioners Shenton and a second from Dr. Nelson and Commissioner Butts. Any discussion on the motion? Hearing none, all in favor say aye.
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 And is there anyone opposed? Okay, thank you. Clear majority, and we'll go ahead and do that, and we will certainly hope that the numbers stay down in Custer County. And we can see them decline in all of our counties and throughout our district. We know it is a concerning time coming forward. And we know the importance of keeping children in schools and the importance to families of all the activities. But we hope that everybody will be safe and we can keep these numbers controlled. I can't say enough for the hospitals, the efforts they're putting forward, everyone in the medical community for the work that's being put in. They are being stretched, and I appreciated what Mr. Hoffenberg said. It's been going on for some time, and somewhat of a battle fatigue for those who are serving on the front line in these hospitals and in the medical community. But our community thanks you, and certainly our board. Other comments, or Jerry, other business you need before we close?
That is all the business we have for today, Mr. Chairman.
So when do you foresee our next meeting, or do you want to put a date on it today?
I guess that could be some conversation with the board. We actually have on our normal Board of Health agenda to be scheduled for November 19th. And I would maybe suggest that we look towards having our next meeting on that date. Of course, unless something critical happens in the meantime that we need to call a meeting. I will continue to be in contact with our hospitals and be able to provide any updates or direction to the board if we need to meet sooner than the 19th, but that's what I would suggest.
And what time did you want that on the 19th? Was there a time change or same time?
Well, our normal meeting was scheduled at 9 a.m. I guess we need to assess the board members if a 9 a.m. meeting would work that day, or if we need to keep it at 7 a.m.
I need 7 a.m.
Okay.
Seems
7 a.m. for me too.
okay. Seems like it's been working for us and for everyone who, has work to do during the days, more work. So we will leave that at 7 a.m. then on the 19th. Unless your needs come up that you need us to meet briefly before then. Jerry, so again, thank you to everyone. Thank you to the community for all your efforts and what everybody is doing to help keep hospitals healthy, and we wish you well. I'll go ahead and bring this meeting to a close. Thank you.
Thank you, Mr.
Thank you,
Chairman.
Brian.
Thank you all. Thank you, Jerry, James.